So up to 60% of people with chronic pain also suffer from depression. Hi, I'm Dr. Ruth, the Pain Doc, founder and medical director of Chronic Pain Rescue, a soon and up and coming telehealth practice dedicated to helping people who suffer from chronic pain to live pain-free, or at least with a lot less pain, and to live the highest quality of life possible. So the topic I want to share with you today is about depression, because many people with chronic pain do suffer from depression. Now, I'm not a psychiatrist. I'm not a psychiatric expert, but in the coming weeks, I am making arrangements to interview someone who is an expert in that field, because I do believe it's important for you to get as much information that will help you as possible. But I do feel I want to speak about that topic today, at least in some general terms, things that you may or may not know that would help you. Number one, if you're feeling suicidal, homicidal, please get help. There is a national helpline, hotline for people with depression. If you call 988 anywhere in the United States, there are people ready to help you and get you the help that you may need to overcome and to get back to being hopeful. All the things, to be honest, that I have been mentioning over these past several weeks that help with general overall well-being and help with chronic pain, they will help with depression. So if you don't have much of an appetite because of your depression, or if you are eating a lot of junk food, please, when you eat, make sure you're eating fruits and vegetables, eating things that come from the earth, that have all the nutrients and things that are going to help you, your body and your mind, to heal. Drink lots of water. You could be surprised that you may be dehydrated, don't realize it, but when you drink more water, you feel more alert. All of your metabolism is able to function in the way that it should, and you do feel better. Aerobic exercise in particular helps with depression. When your large muscles, say your legs, your arms, are moving, that helps you take in more oxygen. More oxygen goes to your brain, which is going to help stimulate the production of your natural endorphins, opioids, painkillers, so you feel better. And a couple things I haven't mentioned, we know sleep, get that taken care of. If you have difficulty sleeping, speak with your doctor. Try taking melatonin. There are other helps that I know of from homeopathy as well that can help you get a good night's sleep. When you're sleeping, your body is being restored and healing. So it's important to get a good night's sleep. It's important to learn how to manage your stress coping mechanisms so that your stress levels are down, and that's going to help. There's spiritual help. I don't know what tradition you may come from, but maybe you know about prayer. Prayer works. It does help. But whatever spiritual tradition you may come from, if you're not practicing it anymore, see if putting those things into practice that help you, because they really may. Talked about journaling in the post that I've posted. That can help. There's one other thing though that I'd like to mention that I have not mentioned before. Do something good for someone else. It's amazing, but when you take your mind off yourself and direct it towards someone else, it makes a huge difference. It not only blesses the person that you're blessing, it blesses you. And it may not be doing anything more than making a phone call to someone that you haven't spoken to in a while and to see how they're doing. Not to say what's going on with you, but really just to check in with them. Bake something, make something, reach out. Look for a way to be a blessing. We're all here to bless each other. But that's pretty much all I have to share today. Until next time, peace and blessings.